Thank you, Dr. Tedros. This region is very committed to global health and to key role of WHO as the lead health agency of the United Nations. Before to come back to the question for Dr. Jacob, I'm sure that there will be a number of comments and questions on the issue you raised. Now I ask delegates wishing to speak to raise their nameplates. I see that Armenia, you can have the floor.
Thank you. Mr. President, Honorable Director General and Regional Director Excellencies, Honorable Ministers, distinguished delegates, ambassadors, ladies and gentlemen. First of all, I want to express my gratitude for the opportunity to speak here at the 68th session of the WHO Regional Committee for Europe and express confidence about the usefulness of the discussions going on here. As you know, Armenia recently has gone through the fundamental political changes after the transition of power has taken place in our country. A new prime minister was elected by the parliament, forming a new government. The new government is aimed to build a prosperous and democratic society, and we do understand that in this context it is crucial that health is in the top priorities. Current priorities of the Ministry of Health include prioritizing the health and increasing allocations for health. We do know that despite annual increases in our health budget, it is still low by international comparisons as a share of government spending, a share of GDP, and in absolute per capita terms. Now we are very keen to increase the health budget allocations for 2019 and go further with an introduction of the health insurance system that will help us to achieve the universal health coverage in Armenia. The next priority is the strengthening of primary healthcare system in Armenia. The PHC strategy has been in place for over 10 years. It envisages that PHC should be eventually provided predominantly by family doctors and nurses, while neurospecialists in polyclinics should either be trained as family doctors or merge with their functions with hospital outpatient services. Implementation of the strategy to date has been quite successful at improving clinical skills and doctor distribution in rural areas. The PHC service delivery model definition and new strategy is also included in the list of our priorities. Preventing and controlling NCDs and promoting healthy lifestyle are top priorities in the current health agenda of the government of Armenia. We now have about 62% of the targeted population involved in screening programs that tackle diabetes, hypertension, and cervical cancer. We already have observed tangible results, and we hope to see a significant decrease in mortality rate associated with these three NCDs in upcoming years, and therefore we are committed to expand these screening programs. Unfortunately, we have a high prevalence of smokers in Armenia. About 52% of adult males are daily smokers. In 2004, Armenia ratified the WHO Framework Convention on Tobacco Control, which created a solid foundation for designing the law on limiting realization, consumption, and use of tobacco products later the year. I'm glad to share that our team is now working on new tobacco law, which imposes a longer list of restrictions on realization, consumption, and use of tobacco products in Armenia. We are determined to win this battle and to protect our citizens from the second-hand smoke exposure. Healthcare reforms aimed at public health strengthening, PHC restructuring, improved quality of care, and other areas will create a basis for further reforms to achieve the goals of universal health coverage. Currently, Armenia has favorable conditions for further effective health system reforms due to the strong political commitment to these reforms. Thank you.
Thank you. According to the list of speakers, the delegate of Norway, you have the floor.
Thank you, Chair. Norway thanks the Director General for his address. We would much appreciate the DG's response to a few comments from our side on the proposed program budget. The document contains, in our opinion, insufficient detail about what kind of calculations and projections that have been made. We do recognize that the value of directing the attention of member states only to the strategically relevant information, but without information on budget envelopes and shifts in emphasis between programs, an informed discussion on priorities is difficult. We also wonder what projections have been made with regard to polio funds. It seems the Secretariat assumes all of the current polio funds will remain available and become flexible. In addition, a significant growth in the base budget is assumed. We would appreciate the Secretariat's comment on how well-founded these assumptions are. WHO's role in global health is unique, partly because of its normative function. We worry that the entire proposed increase for headquarters is offset by a headquarter absorbing all of the organization's efficiency savings. It is our opinion that this is not reasonable, and it implies a risk of weakening WHO's normative function. Efficiency savings should be a goal for the entire organization and should be absorbed by budget centers proportionally with the proportion of the organization's budget. We ask that the next version of the budget reflects this and includes a description of how headquarters' normative function will be protected. Norway fully supports aligning WHO's work with country needs and achieving results at country, but we also need an assessment of how this is achieved most effectively. We question the notion that achieving higher impact in countries automatically require more resources to country offices. Changing their priorities or ways of working would also have such an impact. And we do miss a discussion of whether strengthening technical units at a regional level instead of adding more technical people in each country office can contribute to an even higher impact. Lastly, we refer to the statement delivered by Iceland on behalf of a number of countries at WHA this year, asking for a document that provides clarity on which functions lie in WHO country offices and other characteristics that typically will apply to them. Without such information, the governing bodies do not have the information they need in order to assess country offices' resource needs. Since this program budget will implement the DG's proposed shift towards country level, this document should be presented to EB 144 in January 2019. We ask that the DG confirm that the EB will in fact be presented such a document. Thank you.
Thank you. I shall now give the floor to the delegate of Austria.
Thank you, Mr. President. I speak on behalf of the European Union and its members and the candidate countries of the former Yugoslav Republic of Macedonia, Montenegro, Serbia, and Albania, as well as for Bosnia-Herzegovina, Ukraine, the Republic of Moldavia, and Georgia, aligning themselves with this statement. The EU and its members welcome the bold and ambitious agenda as expressed in the General Work Programme of Work 13. Concerning the increased country focus of the GPW 13, we also echo the voices raised during the last World Health Assembly and the Executive Board that called for a thorough and transparent discussion about the role, function, and current status quo of WHO's work in the countries. Such an in-depth examination should be carried out by the governing bodies and focus on financing, staffing, and alignment with the wider UN reform. The further strengthening of WHO country presence should be taken forward under the oversight of the EB and the World Health Assembly. We welcome your proposal, Mr. Director General, to conduct country visits by EB members to further deepen the understanding of WHO work in the field, as it's already happening in the European region. With regard to the transformative agenda, we support the efforts to increase WHO role in the global health architecture, and we expect the Secretariat to fully involve the governing bodies for ensuring their oversight and guidance to this process. Throughout a transformative process, it is of utmost importance to be clear about the core functions and WHO comparative advantage, namely, first, WHO roles as the coordinating and convening authority in global health. Second, setting of global norms and standards. Third, WHO's role as the evidence-based advocate for public health. And fourth, WHO's capacity for preparedness and response in health threats. The continued fulfillment of these four core functions calls for a strong and efficient WHO presence in Geneva. We do not support transforming WHO into a primarily an implementing agency. We recognize the new focus on data and matrix in the GPW13, and in this regard, we reiterate the experience of the European region in evidence-led policymaking as facilitated by the mechanisms for the European Health Information Initiative. We equally expect the joint monitoring framework for simplifying reporting to serve as a good practice for the success of the Agenda 2030 and on the global level. The EU and its member states value your leadership in taking forward key issues in global health, given the NCDs are the main cause of morbidity and mortality globally. We stress this need to address inequalities in the prevention and management of NCDs. We recognize that the 40th anniversary of the Alma-Ata Declaration will be a decisive moment in designing the future of primary health care and of health for all. This aim won't be reached, however, unless political commitment to universal health coverage will be achieved. In this context, we underline the pressing need to create attractive working conditions and safe working places for the upscaling and retention of the health workforce. WHO has reinvigorated its role in health emergency and preparedness. A concerted effort is needed now to upscale countries' capacities with a whole of government, whole of society, and all hazards approach. The EU and its member states are dedicated to a strong WHO, committed to reaching the goals set by the GPW13 and the Agenda 2030. And on this note, I would like to say thank you.
Thank you. I now give the floor to the delegates of Romania, to be followed by Poland. Both of you are also in the previous list of speakers for Dr. Jakob, so keep your intervention to 3 minutes if possible. Please, Romania.
Thank you. Thank you, Mr. President. Your Excellencies, Mr. President, Madam Regional Director, and Mr. Regional Director, I'd like to start declaring that Romania fully supports the statement of Austria in behalf of Europe, member states. Allow me to express my gratitude for the complete and comprehensive and complex report presentation by Madam Dr. Zsuzsanna Jakab. It is essential to emphasize that the objectives and priorities that WHO Europe is fully involved, not only politically, but at the level of implementation, universal health coverage, no one behind, better health for all, from mother and child to elderly health and gender inequalities. We, especially the delegation of Romania, has to thank WHO team and you personally, Madam Director, from the efforts that you constantly made and continue to make in order to find solution to our national problems, especially with communicable diseases, vaccination, primary care services, and not only to find solution, but also to tend to implement the plans, the programs to obtain the final goal, universal health coverage. Dear Madam Regional Director, Your Excellencies, your successful visit in Romania in the last years were for us critical for the implementation and development plans you have always recommended, NCDs, communicable diseases, primary care. We have a lot of work in the future regarding all the objectives of the SDG agenda. More efforts to spend needed. We need to accelerate progress if we want to reach the SDG targets. More commitment and focus are needed from all the sectors in achieving health in all policies. Continue what we are doing is essential, better monitoring and evaluation of the health intervention, increased use of evidence in policy planning, and persuasion of implementation of the national health strategy could bring important added value in achieving better health for all. Thank you.
Thank you. Poland?
Thank you, Mr. President. Just to clarify, my intervention refers to agenda point 2A. Director General Dr. Tedros, Madam Regional Director, Honorable Ministers, colleagues, Poland fully aligns itself with the statements made by Austria on behalf of the EU and its member states. Madam Regional Director, Poland appreciates your comprehensive report and your leadership in the Euro region. We would like to thank for the efforts of the WHO Regional Office to respond to current health, social and political challenges, and for the ongoing work to assist member states in implementing the Sustainable Development Goals and Health 2020 strategy. We appreciate all the activities taken in order to strengthen health systems, to prevent and to fight non-communicable diseases. Thank you for organizing or co-hosting a number of meetings on these issues, in particular health system response to NCDs that took place in Sitges, Spain, and health systems for prosperity and solidarity, leaving no one behind in Tallinn, Estonia. We note the new approach to value for money in health systems, and we wish to cooperate towards more efficient health systems based on effective disease prevention and high-quality healthcare that is not financed out of pocket. In this context, we wait for the outcome of the Astana conference, an important step towards achieving these goals and strengthening universal health coverage. Director General, Madam Regional Director, we note the ongoing process of WHO transformation and reform. We thank for including items related to these processes in the agenda of this meeting. Finally, Poland wishes to reassure that we remain fully committed to political and targeted technical cooperation with WHO. Thank you.
Thank you. I shall now give the floor to the delegate of Kyrgyzstan, followed by the delegate of Germany. Please.
Thank you very much, Chairman. Director General, Regional Director, distinguished members of the meeting, on behalf of the Health Ministry of the Republic of Kyrgyzstan, I would like to convey my warmest greetings to the participants in today's meeting and also express our deep gratitude for Dr. Tedros' address and that made by the Regional Director. The health of a country's population is the main wealth of that country. And that being the case, the Kyrgyz Republic is trying very hard to work in the direction indicated to it by the World Health Organization. The organization has given long-term support and assistance to us in reforming and overhauling our health sector. And at the moment, it is offering support to us as we develop new programs to protect the health of our people and to further develop and improve our health system. Obviously, our goals are to ensure that we have universal health coverage by 2030. Dr. Tedros' address to heads of state to support the global movement towards achieving WHO goals has been positively responded to by our president. And that, in its turn, has furthered discussions of health at the highest political level in our country. It's also helped us to give priority to the main health issues in our overall development program. We are working in line with the latest WHO General Program of Work and the 2020 European Health Plan, as well as the Sustainable Development Goals that relate specifically to health. All these things are priorities in our overall Health Development Program for 2019-2020. We are trying to ensure that we provide good quality healthcare to our people, that we can fight particularly against non-communicable diseases, engage in more efficient targeted procurement, bring down the price of drugs, and ensure that our people have access to healthcare, immunization, and good quality medical care. I'd like to draw your attention, if I may, to the fact that since we have very little time left before 2020, we are working hard on improving medical care. As of October, we are bringing into operation a new program for performance-based salary payment, which we hope will benefit our people. We have had a meeting with Dr. Tedros to discuss the organization and his support to our programs. In this context, we are stepping up cooperation with the World Health Organization, expanding the areas on which we're working with them, and make sure we contribute to that cooperation more. We are particularly attached to health promotion at the highest possible level of our political apparatus and ensuring that health protection is taken into account in all sectors of our economy and of our society. This year in September, together with the country office in WHO, our health ministry was able to hold World Games which are tobacco and smoke-free, and I think that is extremely important and very positive. It's a positive step that we can take with minimum expenditure but with maximum effect. In conclusion, I'd like to say that we hope that our cooperation with WHO will continue in a fruitful manner in the future, so as to help us to improve the health of the people of Kazakhstan. That is our ultimate goal. Generally speaking, let me say, just to wind up, that we support the general approach being taken to its work by the regional office of WHO. Thank you.
Thank you. Germany.
Ja, schönen Dank, Herr Präsident, sehr geehrter Herr Generaldirektor, meine sehr
Thank you very much, Chairman. Director General, ladies and gentlemen, Germany would like to associate itself with the statement made by the European Union. Director General, strengthening WHO is, of course, a major priority for Germany because WHO is the only organization which has a global mandate on health policy. It is the WHO that has legitimacy worldwide because it is an organization, after all, with 194 member states. Germany would like to see a strong WHO, and that is why we have committed ourselves to its work through the Executive Board and the World Health Assembly. We want to strengthen WHO in those areas where we can contribute to her value added. And we also want to see a strengthening of the core mandate of the organization. That means enhancing the functions that can be discharged by WHO, but not by other organizations and bodies. Let me touch upon four of those. Firstly, we would like appropriate resources to be made available in Geneva for normative activities. Secondly, we would like to see the global coordinating role of WHO strengthened. Thirdly, we believe that the organization should be in a better position to pinpoint health emergencies early so that it can respond quickly. And fourthly, we would like to see WHO strengthened in its authority, that authority being based on facts and evidence when related to public health. What we do not want to see, on the other hand, is WHO becoming an organization responsible for implementation on the ground. There are other organizations and parties which are much better placed to do that. So we would like our discussions to clarify the functioning and the role of WHO at country level. This, we feel, is a discussion that should be held in Geneva, in the governing bodies of the organization. And when I say this, I have in mind also the issue of the future reform of the United Nations. Heads of state of government of Norway, Ghana, and Germany have addressed a letter to you, Director General, with three major messages. Firstly, since the adoption of the Sustainable Development Goals, 3 years have gone by. We believe, therefore, that it is essential that we step up our efforts considerably if we want to achieve the health-related Sustainable Development Goals between now and 2030. Next, a major challenge in achieving health-related SDGs is the number of parties involved. In other words, the fragmentation, lack of effectiveness and efficiency and coordination in the global health promotion structure. WHO's task is to coordinate the global achievement of the health-related sustainable development goals. It's there to develop a plan of action for the implementation of SDG 3 in partnership with other relevant bodies and organizations. We are happy that you, Director General, will be able to present that in a month at the Global Health Summit in Berlin. Thank you.
Thank you. So the last speaker in my list is the delegate from Sweden. Please, you have the floor.
Thank you, Mr. Chair. Sweden would like to welcome and express our support for the implementation of the priorities set out in the 13th General Programme of Work. We appreciate the Director General's bold and firm mission to transform WHO to a stronger, more effective and efficient organization and leading the way towards the achievement of the SDGs. We have a strong belief that the strengthened focus on delivering impact in countries will make measurable differences in the lives of the people, especially for those who Dr. Tedros mentioned as most vulnerable. Achieving universal health coverage is essential in this endeavor. Sweden also appreciates the strong emphasis on health as a human right. In this regard, we acknowledge the DG's strong support to sexual and reproductive health and rights as an essential part of universal health care. Ensuring healthy lives and promoting well-being for all at all ages enhances the efforts on emphasizing focus on health equity through actions on social determinants of health, as well as on gender equality. This approach is crucial in all public health activities, including healthcare and social care delivery. Gender-based differences between women and men and boys and girls in terms of health needs, risk behaviors, respective power and control over resources and information, and access to health services is a continued challenge that points to the needs of addressing gender, among others, as a determinant of health. As set out in the GP, we are fully committed as a country to contribute and join forces on WHO and member states' capacity for preparedness and response in health threats. Thank you, Director General, for leading the way in promoting health, keeping the world safe, and serving the vulnerable. Thank you.
Thank you. And now I would please to invite Ms. Alanna Hermitage, the Regional Director of United Nations Population Fund, to take the floor.
Thank you very much, Mr. President, Director General, Regional Director, Excellencies, distinguished representatives, ladies and gentlemen. On behalf of the United Nations Population Fund, the UN's Sexual and Reproductive Health Agency, I'd like to thank the WHO Director General for his inspiring remarks and the Regional Director for her excellent report, as well as the efforts of WHO Europe and its member states to promote better and more equitable health in Europe. WHO Euro's commitment to broad-based partnerships and their stewardship of the regional issue-based coalition on health is part of the reason why the UN system in Europe and Central Asia was cited as a model in the Secretary General's report on UN reform. And this is, in large part, thanks to Dr. Susanna Jacob's leadership, for whom we also congratulate for being nominated the AI UNDG chair for the region. As highlighted in the Regional Director's report, UNFPA's partnership with WHO in support of member states is bearing fruit. An excellent example is our collaboration on supporting member states to strengthen sexual and reproductive health as a follow-up to the first ever Sexual and Reproductive Health Action Plan for Europe, which was endorsed at the 66th session of the WHO Regional Committee in 2016. 3 weeks ago, hosted by the government of Sweden, WHO and UNFPA organized a consultation to take stock of the progress in improving sexual and reproductive health in Europe. It was gratifying to hear from so many countries about the development and implementation of their national sexual and reproductive health action plans, and that they are progressing steadily on their path towards achieving universal access to sexual and reproductive health. It was less gratifying to hear reports from some member states that progress in reducing teen pregnancy, in advancing family planning, and decreasing abortion rates, in tackling cervical cancer, to name a few, are under threat. Despite evidence that investing in good contraception services is one of the most effective healthcare interventions available, in some cases, investment is decreasing in the region. Clearly, there is no health without reproductive health, and any reduction in sexual and reproductive health services will have an impact on our most vulnerable citizens. Ensuring that sexual and reproductive health services are provided at the primary healthcare level is essential for making progress and for achieving the SDGs. Next year, we will celebrate the 25th anniversary of the International Conference on Population and Development, a historic milestone which offers us the opportunity to reflect on the world's progress towards ensuring rights and choices for all. We look forward to seeing many of you at the upcoming UNECE Regional ICPD Plus 25 Review Conference in Geneva, and we would also like to congratulate the government of Kazakhstan, WHO, and UNICEF on the upcoming Almaty Plus 40 Global Conference on Primary Healthcare, another important platform to accelerate progress for all. I would also like to use this occasion to congratulate WHO Europe on putting the spotlight on migrant and refugee health, as well as on men's health. Working closely with WHO and humanitarian partners, our programs in Europe have worked to strengthen national capacities to address the sexual and reproductive health needs of migrants and refugees and to respond to sexual and gender-based violence. When all people can fully exercise their rights and are empowered to shape their own lives, society as a whole reaps the benefits, and we will be one big step closer to realizing our common goal of creating a fully inclusive, healthy, and prosperous European region by 2030. I thank you very much.
Thanks, Ms. Hermitage. I have now reached the end of my speaker list. Dr. Tedros, would you like to respond to the comment and question raised? Susanna first. We have to come back to
I have not yet finished the discussion on my speech, so I will come when we finish that. We still have.
Yeah, thank you so much. I thought we would be doing it together, and I wanted to give the floor first to Susanna, because hers was the first to be presented. So I didn't want to come for the response before her. But I would be happy to respond to some of the issues. First of all, many of the comments are acceptable, and I take them as recommendations. We have, most of them are recommendations, so I don't think they need response. But on some of them, I will try to give my opinion. Plus some of them will need response, so I will respond to some of the issues raised. On the country visit of EB members, I think that's very, very important. As you rightly said, you're doing it in Europe, and it's helping you to see the situation at the country level. And being close to the reality and understanding how things are happening and seeing the real thing is always important. And at headquarters, when we proposed the visit by the EB members, board members, to countries, is because of the benefits we saw, as you have said, by the visits you make at the regional level. So headquarters basically learning from the experiences of the regions. So I would like to thank the director, the regional director, for this. And through this, we are showing that the organization can learn at all levels, from our country offices, from our regions. Everything should not come from the region, from the headquarters. But we need to find best practices like this at all levels and use them. So I would like to thank Europe on this. And we will organize the first visit. The first visit that was proposed for the EB members was a visit to DRC, because there was active Ebola outbreak. This was during the first outbreak. Unfortunately, we couldn't get enough people to join for that visit. It was a short notice, of course, and emergency is always a short notice. That was obvious, but it was very difficult for people to really prepare. And as a result, we just went ahead as WHO from the headquarters without having board members. But we will organize in the future and let you know and try to understand the situations on the ground firsthand. And then on some of the issues raised are related to program budget. On program budget, we will have a program, we will have another agenda in its own right. We will address your questions or your concerns there. But on program budget, as you know, the GPW was fast-tracked. The GPW was supposed to actually be endorsed by May 2019, but it was endorsed one year ahead of schedule in May 2018. So we're using a fast-track approach, and some of the things you said may not be possible to achieve within that timeline. And if you remember, we have already indicated that the program budget may not be detailed enough, and that you will understand because we will not have enough time to go into details, since the whole preparation of the GPW is compressed from 2 years into 1 year. That's number one. And the second is, we're changing from previous practices. In the past, as you know, when program budget is developed, we used to divide it or categorize it by disease programs. But for the first time now, we're trying to integrate it into 3 major streams. These are based on the strategic priorities, if you like. This is on universal health coverage, emergency, and healthy lives. So these are the 3 categories that are actually reflecting all the program areas. This doesn't mean that we will not have funding allocated for TB, malaria, or HIV/AIDS. There will be. But it's better to put them as a bucket based on the strategic priorities, because this will also help us break the silos that you see at the headquarters level because of these very many budget centers which are not helping communication. So that's why we're putting it together, because we want to break silos and we want to show that departments, both in the health system and in the program areas, can work together and think based on the 3 missions which you're saying it yourselves, and to think in terms of one WHO. That will help us to move from a fragmented approach into a streamlined, united, seamless, and that's focused on impact and outcome. So that's why, and it has benefits, and we will have more discussion when we have the other program, the reform and the program budget, to explain more. I don't want to waste Susanna's time on this. Then the other concern you have is on the country budget increase to country offices. And your concern related to that, especially the situation of the normative functions. One thing I would like to assure you is WHO's major role will always continue to be a normative function. It will. If anything is going to be done by WHO, if you ask me to do only one thing, it will be the normative function. And in the years to come, based on the GPW, the normative function which will actually be strengthened. Because one of the major shifts in the GPW is WHO should be relevant in all countries. WHO should be able to do policy dialogue with all countries based on the standards and guidelines and normative functions. WHO should not just work only in low and middle income countries because they need technical assistance, but should be able to do policy dialogue even with high income countries. No country on earth has a perfect system, health system. Any health system you name will have its fault lines. That's why WHO should be relevant even in high income countries, but this will take, of course, years. That means in the years to come, WHO strengths in normative functions actually will be built, not diminished. And our balance will always be on normative functions. But when I say this, we will have to some extent operational aspects. The operation comes not like as a major part of what we do, but as a minor part. If you ask me, it may not be more than 15% of what we do. 15. That's maximum. Some of the operations we do are now, for instance, in conflict areas and in fragile countries, because the health system is completely broke. And we're forced to do it because there is no service as such. And the other times when we're a bit of more operational is in emergency situations, like what's happening now in the RC. When I was myself involved actually, and I have been there since May 4 times. We don't want to give any vacuum for the virus to spread. The virus is aggressive, and we have to be more aggressive. And in emergency situations then, WHO plays a coordination and convening role, plus to some extent participates in operations. But even in emergency situations, most of the operational things are actually done by other institutions. We share it based on comparative advantages we have, like what we're doing in DRC. UNICEF takes some, MSF takes the rest, ICRC, WFP, even MONUSCO, by the way. And then we do the convening and coordinating role, but at the same time, we cover some of the operations. So when we do operation, we're very conscious. When we do operation, we focus on our comparative advantage. When we do operation, we keep it to the minimum. We don't go far. So WHO will never be by and large operational, will never be. And that will not be advantageous for the world. The world wants more of normative function from WHO, more of a convening and coordinating role from WHO. As what our colleague from Germany said, the exercise we're doing now on SDG 3 is actually to maximize our coordinating and convening role, to increase our normative functions, not to be operational. But there will be, since there is a need, measured intervention, measured operation as we can see now. As we speak, the time we spent on operations or resources is not more than 10%. And it will continue to be a minor thing of what we do. And that's what I would like to assure you. And you don't need to be really alarmed by this. And the normative function will be the major part of WHO's, will continue to be WHO's responsibility. Apart from this, I think the rest are, I will take them as comments. For instance, like health as a human right, as a rights issue. And as we always say, an end in itself. You do health to keep people healthy, just without any other even objective. Keeping the individual's health or societal health is an end in itself. And that's why we say it's a rights issue. But there is an added value when you keep people healthy. It's a means to prosperity. So this is a very good value proposition, actually. health as a rights issue and in itself, plus it's a means to development. So it's the smartest thing to do. And health should be used as a foundation for all other SDGs. As you know, if someone, as an individual, anyone from us, is not healthy, you don't aspire for anything. If you're not healthy, what do you want? You only want your health back. That's it. But when you're healthy, you ask for many things. That's why it's the basis. Without health, nothing is important. Not only at individual level, but even at societal level. It's a healthy society that can prosper, that can ask for more and do more. So that's why when we do the SDGs, health should be central. It's not because I am from the health sector. It's because health is central. Nothing is more important than health. But when we say that, it doesn't mean that there are no determinants that has to be addressed, like be it poverty or other issues that aggravate health condition. And that's why we advocate for integrated implementation of the SDG goals. And this world can change if all that we have committed to the SDG as a whole, as a package in 2015, if that's implemented, then we will be better as a package. And all are interrelated, even if I say health is central. So continuing to put health as a central, as a rights issue, I think will be important. And that's why I was reminding you again and again. I was inspired in Denmark, 1988, the first one. Then 1991 was in the UK. By the way, there was another trip that cemented it in 1997 to Sweden. Many of the countries in Europe are the first to start universal health coverage. You have a lot of experience. It's because you believe in it. That's why we always say universal health coverage is a political choice. Many of your countries made a political choice many years ago. It's not because you were wealthy. It was a political choice you made because you knew it was central. And that's why Europe should continue to advocate and promote and support to make this a global position. So thank you so much again for influencing me, for making me believe what I believe. It's because it makes sense, and together we can make universal health coverage a reality. Thank you very much.
Thank you very much, Dr. Tedros. You can be assured that the European region is a strong supporter of the advancement of global health and of WHO.